Hi, welcome to this week's lecture. In today's video, we're going to talk about an introduction to Parkinson's disease. So, what is Parkinson's disease? Parkinson's disease is the second most common progressive neurodegenerative disease, with Alzheimer's being the most common. What does progressive neurodegeneration mean? Well, progressive means that the disease worsens over time with a loss of brain cells or neurons that accompany it. Now, the main morphological characteristic of Parkinson's disease is a loss of dopamine neurons in the substantia nigra, which we will explore further in the next video. Overall, Parkinson's disease results in the loss of movement and the rise of movement abnormalities. James Parkinson was the first person to scientifically describe Parkinson's disease, which he described as a shaking palsy and a collection of symptoms. Nowadays, the collection of symptoms, or the symptom complex outlined in the slide, is called Parkinsonism. The symptoms include shakiness or tremor, often in the hand or finger, stiffness in the limbs, in which the movements are no longer fluid, movements that are slowed down and take longer to complete, so imagine yourself moving in water, and then balance issues and instability, which are often seen in the later stages of the disease. Now, not all patients with Parkinson's disease will have all of these symptoms, but most will usually have these symptoms at some point in their disease progression. This symptom complex is most frequently caused by Parkinson's disease. So Parkinsonism caused by Parkinson's disease is sometimes referred to as primary Parkinsonism. However, this symptom complex can be caused by other diseases as well, which is called secondary Parkinsonism. Later on in these lectures, we will explore a secondary Parkinsonism disease. The risk factors for Parkinson's disease are numerous, and age is the biggest risk factor. So Parkinson's disease affects 1 to 2 out of 1,000 people in the population at any time. The age of onset for diagnosis of Parkinson's disease is usually 60 to 70 years old, and the risk for developing Parkinson's disease increases each year after the age of 60. Parkinson's disease before the age of 40 is observed in less than 5% of the cases, and this is termed young onset or early onset Parkinson's disease, and genetic factors often play a much larger role in this type of Parkinson's disease than the normal type. Also, men have a higher risk factor for developing Parkinson's disease than women, and most cases are idiopathic, which means that there's no known cause and no prior genetic risk factor. Environmental risk factors for Parkinson's disease include exposure to pesticides and chemicals, repeated concussions, as well as inhalation of heavy metals, including copper and manganese. So living in an industrial area may increase your environmental risk for Parkinson's disease development. As mentioned before, there are numerous genetic risk factors, such that first-degree family members of patients have a 2 to 3-fold increased risk of developing Parkinson's disease compared with the general population. In this course, we won't go over the specific genes that have mutations that increase the risk for Parkinson's disease. As Parkinson's disease is a brain disease, there are numerous non-motor symptoms of Parkinson's disease as well, and these are often much more difficult to treat. They include problems with smell, constipation, depression, apathy, anxiety, sleep disorders, problems with attention and concentration, memory loss, confusion and dementia, and orthostatic hypotension. Again, not all patients will exhibit these types of symptoms. As mentioned previously, Parkinson's disease is characterized by a loss of dopaminergic neurons in the substantia nigra, which can be seen as these dark-colored neurons in the brain, and this loss occurs in cases of Parkinson's disease. Other hallmarks of Parkinson's disease include Lewy body accumulation, which we will not be going into in this course. The next video will explore the pathophysiology of Parkinson's disease in more detail.